In this second part of the lesson on oral infections, we will be covering bacterial infections and mucosal or fungal infections. Again, there are many bacterial infections, but we will be covering a very small sample number of these infections. Please review your Dental Hygiene 366 lectures for more bacterial infections. The first one we'll cover is scarlet fever, and we had talked about this last semester. Scarlet fever is caused by group A streptococcus. The signs and symptoms are fever, headache, sore throat, rash, a bumpy rash, lymphadenopathy, and a red tongue that may also appear bumpy. So a red bumpy rash is indicative of scarlet fever, and as I said, sometimes the tongue even turns red. Most times scarlet fever is treated without complications. However, it can cause heart and kidney complications. Osteomyelitis, which we have covered in various other parts of this DH367 and 366, is caused by Staphylococcus aureus. The signs and symptoms are fever, swelling, pain, and warmth at the site of the infection, and fatigue. Syphilis is a sexually transmitted disease, and if left untreated or partially treated, the disease will progress through 3 stages. The causative agent is Treponema pallidum, and it's a 3-stage disease if it is left untreated or partially treated. The signature lesion for the primary syphilis is the chancre. That's noted on the tongue on the far left picture. Mucus patches are usually indicative of secondary syphilis. Those are those circled areas in the picture on the far right. And if it ever gets to the tertiary stage, there's something called a gumma, which we talked about. It's a gummatous necrosis that eventually leaves a hole where the tissue has necrosed and died, and you can see that hole in the palate of the patient on the far right. Congenital syphilis affects the newborn in multiple ways. Some of the ways are what we call saddle nose. Notice that the bridge of the nose is depressed. Interstitial keratitis, which is an eye infection. Orally, we'll see what we call Hutchinson's incisors. Those are sort of notch-shaped incisors. And mulberry molars. If you take a really good look at the first molars on the mandible, the occlusal looks kind of like a mulberry, sort of pebble-like, not like your usual type of occlusal anatomy. Cat scratch fever. The causative agent is Bartonella henselae, and it is a cat scratch or bite that does not heal. So it can be a pet or it could be a feral cat. Generally what happens is that there's continuing redness at the site. They can be also a small blister or a bump. There's fever. There can be lymph node swelling and pain, headaches, chills, fatigue, sometimes a rash, and nausea, vomiting, and no appetite. Unfortunately, cat scratch fever is self-limiting. Mucosal or fungal infections generally occur when there is an imbalance in the natural flora of the body. This often happens when we take antibiotics for bacterial infection. Since the antibiotic does not specifically target just the site of the infection, the whole flora of the body is affected. An imbalance is created and fungus can proliferate in the absence or decline of bacteria. Candida albicans is the cause of the 6 conditions we are covering. So candidiasis normally resides in the body or skin. So if we were to take a sample off of your mouth or my body, you would find Candida present on our skin. When it becomes a problem, like I mentioned, is when the normal flora of your body is imbalanced. So, again, antibiotics. The other time of imbalance would probably be things like immune deficiencies or terminal disease like cancer. And the chronic hyperplastic form, which we will talk about shortly, is considered to be malignant. So now we're going to talk about the different types of candidiasis. Pseudomembranous candidiasis appears as white plaques. These plaques can be wiped away, leaving raw red areas under the white plaques. Sometimes you will hear it called thrush. That's the old term for pseudomembranous candidiasis. The causes are illness, smoking, some medications. We've talked about antibiotics, that's one of them. Pregnancy and dental appliances will cause the patient to have pseudomembranous candidiasis. Not all candidal infections are white. Erythematous candidiasis is a red plaque. It is symptomatic and often appears under dental appliances. So what you see is the patient on the closer to the right-hand side is a patient with dentition, but has a case of erythematous candidiasis on the palate. And to the far right, you see a denture patient who has candidiasis, the erythematous type candidiasis under a denture. When the patient has an appliance, denture, partial denture, and has candidiasis under that appliance, both the patient and the appliance need to be treated. So the patient has the infection, but the appliance also needs to be treated. Appliances, the plastic with appliances is relatively porous and can pick up the candida and hold that candida in the resin, in the base of the denture or the base of the partial, and continue to reinfect the patient. If treating the patient and the appliance is not satisfactory, or the patient continues to have an infection, then the patient needs to be told, or needs to be recommended to the patient, that the appliance needs to be remade. Chronic hyperplastic candidiasis is the candidiasis that can be considered to be pre-malignant. In this particular picture that you see, what it looks like is perhaps a cheek bite, or even a very exaggerated linea alba. Again, you'd have to take a look at the history of what findings were in the original intraoral extraoral examination to make a determination as to whether or not this would be chronic hyperplastic candidiasis. Angular cheilitis, or perlesh, that's another old term that you will hear. Angular cheilitis is usually an underlying chronic fungal infection. It can also be caused by loss of what we call vertical dimension. In other words, the height of your jaw has been compromised either from dentures, where the height is not back to the original vertical dimension, or the loss of posterior teeth. Median rhomboid glossitis was once considered an anatomical landmark. Now it is believed to be a chronic candida infection, and it appears on the posterior part of the dorsum of the tongue. Again, if it's treated with antifungal medications, it will dissipate and go away. This concludes the section on bacterial and mucosal infections. Again, if you have any questions or comments or issues, please do not hesitate to get in touch with me.